Dr. William Evans is up next, the founder and co-director of the Children's Heart Center in Nevada and the author of the textbook Simple and Easy Pediatric Cardiology. His paper today is entitled The Relationship Between Maude Abbott and Helen Taussig and the Origins of Pediatric Cardiology. Over to you, Dr. Evans.
First of all, thank you for the invitation. I am truly humbled to be included in this illustrious to be included in this illustrious group of speakers, and also the attendees are equally illustrious. So it's happy 153rd or 154th birthday. I think Richard's going to talk a little bit more about that later. So first, I'd like to give some thank you to my primary source material, including the Osler Library, the McGill University Archives especially. About a little over a decade ago, I visited them, and they Xeroxed for me the entire 1930 to 1940 diaries. So I have these huge stacks of Xeroxes that I've gone through on multiple occasions. The Maude Abbott Museum, of course, Johns Hopkins Chesney Archives, Clifton Leach family memorabilia, and my own historical book collection. So these are the two most impressive titans, as far as I'm concerned, that laid the foundation for the specialty that I'm involved with. A little bit about the past. There really is very little literature about the documentation of these two individuals' relationship until I ran across the Abbott diaries at the McGill Archives. And they provide an abundance of evidence of a close connection between them, and their association clearly appears very complex. It's influenced both by difference in age and era-related notoriety, and among other issues. But they laid the foundations for congenital cardiology. They excelled in an academic world ruled by men who failed often to support their deserved academic advancement. So the origin story is that in the winter, I believe of 1898, I may be corrected on that, as the assistant curator before her elevation to curator, she visited the DC Army Medical Museum, and of course, then went to Baltimore to visit with Osler, who then invited her to his home that evening for one of his student nights, and there described to her the importance of the museum as a teaching tool, which, as she said, and so Dr. Osler gently dropped the seed that dominated all my future work. There's the two of them, about age appropriate for that time in 1898. So she returns, as we all know, and finds this specimen, which is incredibly intriguing to her. In the Holmes Heart, we've heard through the day, its history. From my perspective, I first heard the term probably in about 1978, early in my fellowship training. I never went further than just hearing the name, knew nothing what it meant, and heard nothing about Maude Abbott until much later in my career. And there may be reasons for that. But this is the specimen that launched a specialty. Now, this is actually a patient that was recently seen in our clinic, and this is a double inlet left ventricle, single ventricle, two AV valves opening into here, and with normally related great arteries, as if there's any Pete's cardiologists in the audience, and I think Marie's in the audience, we'll see. So a Holmes heart is a double inlet left ventricle with normally related great arteries. It's not a common form of single ventricle, only accounting for about 3% of single ventricles. And in our practice, that's about one patient per year. Single ventricles, however, constitute more than half of the complicated congenital heart disease that we deal with in the newborn period. So single ventricles are actually quite common. The Holmes heart is one of the rare forms of it, but we see about one patient a year. A little bit about Helen Taussig is obviously Maude's biography is well known. She was born in Cambridge, Massachusetts in 1898. Her father was a very famous Harvard economic professor and government advisor and world traveler. Her mother died of tuberculosis, as we all know Abbott's mother did in infancy. Hers died at age 11. She initially attended Radcliffe, which was all women's at the time, but went to Berkeley with her father on one of his trips and liked it there, and then transferred to Berkeley and graduated in 1921. She told her dad that she wanted to be a doctor. He said she's ridiculous, that she should do something else. It's not for her. She persisted, and she ultimately matriculated into the Hopkins Medical School, which was one of the few that accepted women. She did spend time working with quotes unquote cardiologists. They certainly weren't known as that at the time, at Hopkins for about a year prior to starting her pediatric residency. And she was interested in the heart even in undergraduate years. The lore was, I was told, that Edwards Park, the head of pediatrics at Hopkins at the time, appointed her as the first director of the cardiology clinic in 1930. But that wasn't true. The first director of the cardiac clinic was an individual named Clifton Leach. And I wrote a paper about him, published in Cardiology in the Young. He actually was the first director and came in about 1928. After about a year, though, he told Edwards Park, I'm going to leave around July 1930. So this is a picture circa April 1930 with Park in the middle, very tall guy, and surrounded by his faculty and his residents. As you can see, there's 4 or 5, let's see, 1, 2, 3, 4, 5, 6 women. So even then, pediatrics was a specialty that embraced women physicians, which we're all proud of. And that group of faculty there are some of the biggest luminaries in the history of pediatrics, and each one could probably deserve a lecture series. Clifton Leach has pointed out, as I said, he had already said he was going to leave in July of 1930. So Park was aware of Taussig's interest in the heart and thought that she would be an ideal director of the clinic once Leach had left. Now, she was just a resident at the time and was a little bit shy about taking this position. And she said early in 1929, in a letter to Park, after these confessions, I hope you will not misunderstand my refusal. The field does interest me tremendously, and I very much appreciate you asking me. So another whole year goes by, and Leach hasn't left yet. It's still April of 1930. This is the time that picture was taken, but she was in Boston. She was doing a away clinic, an away rotation at MGH at that time. Her dad lived in Cambridge, and so it was easy. She stayed at her dad's home. And Park wrote to her, and she again said, this is now a year later, you asked me to let you know how things are going. They, meaning the MGH docs, kindly introduced me to a group of cardiologists who met one evening a week at Dr. Paul White's laboratory. And she goes on and says, please don't misunderstand what I'm going to say, for I want to come back, and I think I shall probably see my way to it. Actually, her father was trying to convince her to stay in Boston and at Boston Children's or at MGH. Well, Dr. Abbott made a trip in April of 1930 to Boston to Paul Dudley White, who was her close friend. And she was asked to come and do a symposium at MGH at that time. And this is Paul Dudley White, who is, as many know, one of the founders of adult cardiology. This is where his lab was, in the Bullfinch building in 1930s. And a very unexpected thing occurred. A few days after she had written to Park to say that she was really uncertain about taking the job as the director of the clinic, she writes to Park and says, last night, there was an interesting and formal meeting at Dr. Paul White's laboratory, at which Dr. Maude Abbott showed a most extraordinary heart. Now, in my fantasy, I hope that to be the Holmes heart that she brought from Montreal to show, but who knows? In Maude Abbott's diary on April 21st, she simply enters Mass General Hospital Heart Conference in the evening. So then, a day or two after this, Taussig writes a letter to Park and says, "The die was cast last night in favor of Baltimore. You know, without me telling you, that professionally, I am tremendously glad to come back to your department and very much appreciate the opportunity you offer me. I hope and shall try hard to make the most of my opportunities and not disappoint you." So the tone of this letter is now totally different after this unexpected and I think inspirational evening she had with Maude Abbott presenting the heart, surrounded by these other academic men. They would be the only two women in the room. A year later, Abbott travels to New York for the New York Academy of Medicine graduate fortnight meeting, which we've already heard about today. And this is the New York Academy of Medicine in the 1930s. I too love architecture. It seems like we have a lot of architectural aficionados in our group. And in her diary, she notes that she met Dr. Helen Taussig and discussed a case of congenital heart disease, situs inversus with tetralogy of Fallot. The next day, she writes and says that she went by and visited Dr. Taussig's exhibit, who had an exhibit on an AV bundle. From that same trip, she travels to Baltimore, and she's very familiar in Baltimore and Hopkins, of course. By this time, remember, this is 30 years later from her initial trip. She's now world famous and constantly requested speaker. And she knows Helen Taussig now and spends the evening at the home of Dr. Taussig, and then discusses congenital heart disease cases for the next several days in Hopkins. In Maude's diary, she enters Helen's address. And if you look at her diary, she has very few addresses entered, but Helen Taussig's address is entered 1414 Lake Avenue, which is this house built before that era. So I suspect it looks exactly the same as it did then. A year later, she comes to Philadelphia for a meeting of the International Association of Medical Museums, of which Helen Taussig is at. This is the meeting. Then she travels to New York and boards the ship to take her to Europe for the centenary meeting of the British Medical Association. And indeed, she does go on a Mediterranean cruise before that. Was all-inclusive, Mediterranean cruise first, and then London afterwards. And here's a picture of the Aquitania leaving. And my research has Helen Ingleby with her on that ship on that trip. And here's the exhibit, as we've seen multiple times today at the Judd Laboratory and the Royal School of Mines, which became, by the way, a big hit, as I think we've already alluded to. The medical journals at the time raved about the number of cardiologists who were overwhelmed with this exhibit, and clearly it caused a ripple effect in London. A year later now, another meeting of the International International Association of Medical Museums in DC. DC, as we all know, is next to Baltimore. And who does she go visit? Helen Taussig again. And she comes again another year to one of the New York Academy meetings, fortnight meetings in New York. And where does she go again? To Baltimore to visit Helen Taussig, and they have dinner. In 1935, she goes to New York, and she works on the atlas, finalization of the atlas with the American Heart Association, and visits with Paul D. White at the time, who we've also alluded to several times during the conference. Paul D. White writes the foreword and says, most pointedly, that Dr. Abbott has been the most important of the pioneers in establishing congenital heart disease as a living part of clinical medicine. So a copy of the first edition of my collection. Then in April of 1936, another year later, she's at another meeting of the International Association of Medical Museum, of which Helen Taussig is at also, and they get together yet again. And this is the meeting in which now Helen Taussig presents an abstract. So now we have the young Taussig presenting an abstract with the presence of her friend now for the last 6 years in the audience. The abstract is titled, "Two Cases of Congenital Malformations of the Heart Due to Defective Development of the Right Ventricle, Clinical and Pathologic Findings." The Q&A is transcribed in the journal. I actually have this by just sheer chance in my collection. And there are some initial questions by Howard Sprague of the stethoscope fame and Maurice Lev, who is a well-known congenital heart pathologist, especially in the early 70s and into the 80s prior to his death. But most importantly then, and this is all transcribed, the 67-year-old icon, Maude Abbott, rises and begins to question her friend, the 38-year-old newbie, Helen Taussig. She begins, "I wonder if it's right to call this an absence of the right ventricle. Should it not be aplasia of the right ventricle? It sounds as if this were a 4-chambered heart in which the right side has become aplasic and was of no use, but was still there anatomically." Dr. Taussig answers, "In the second case, the right ventricle was markedly hypoplastic." Abbott continues, "In the first case, you could find no trace of it, and yet you had a pulmonary valve above, a pulmonary artery above." Taussig, "In the first case, there was no demonstrable evidence of a right ventricle. It may be more accurate to consider it an aplasia than a defect. I merely meant such a case appeared to represent a failure of the right ventricle to develop in the normal way." Abbott, "It's an interesting point. These cases that have been described as cases of defect, I think are not really so from the anatomic standpoint. The case we had at Bellevue Hospital was just like that. If there is a pulmonary artery, there should be a trace of right ventricle." Dr. Taussig, somewhat in resignation, "Then it is aplasia." Well, in 1979, many years after, Helen Taussig now at a symposium at Children's Hospital Los Angeles, where I trained, and I was in attendance at this dinner meeting after the symposium, in which Helen Taussig was the special guest star. She was interviewed by one of her Hopkins friends, shown in this picture, and they got around to talking about the absent right ventricle story. And Helen goes, "The first time I reported the case, I was severely criticized for not showing a picture of an absent right ventricle. I just said, it's awfully hard to photograph that which does not exist." Well, I remember being in the audience and everyone, laughed approvingly. But it still stuck in her craw all those years later. Very interesting. So from a pathological curiosity to now congenital heart disease surgery, during Maude Abbott's life in Boston Children's Hospital in 1938, the first patent ductus arteriosus was ligated. Subsequently, she died in 1940, and a few years later at Johns Hopkins and Harriet Lane, the now known Blalock-Taussig Thomas shunt was first performed for tetralogy of Fallot. Boston Children's in the 1930s, these were the two behind the PDA ligation, John Hubbard, the pediatrician, Robert Gross, the surgeon. This is just a picture of a ductus being ligated. For those that aren't pediatric cardiologists, this is the ductus, and now this is it constricted with a suture. Seems like a simple surgery. It was absolutely mind-blowing for the medical community at the time. It was totally earth-shattering. In the first paper that reported it in the New England Journal in 1939, that homage was paid to Dr. Abbott from a study of the statistical data compiled and recently published by Abbott it appears that the patency of the ductus arteriosus as a single defect may be less rare than it was formerly thought to be. So right about this time also, Dr. Abbott was planning a comprehensive textbook of congenital heart disease. Between 1938 and 1939, she was laying the groundwork. She had signed a contract with a publisher, and she applied for and received a fellowship grant from the Guggenheim Foundation. And she wrote a letter to Edwards Park at Johns Hopkins. And she said, a condition of the fellowship is that the work is to be carried out in the United States. I am planning to spend some time in the Department of Cardiology at the Massachusetts General Hospital. I would very much like also to spend a couple of months in Baltimore next autumn, both in the Welch Library, and to follow the clinical work in pediatrics on your service at the Harriet Lane Hospital. However, in that letter, there is no mention of Helen Taussig. Remember, they've known each other now for almost a decade, and she is the director of the cardiology clinic at this point. Abbott dies in September of 1940, before the textbook could even be begun. The story now moves to Johns Hopkins in 1940s with Alfred Blaylock, Vivian Thomas, and Helen Taussig. Taussig became interested in a condition called tetralogy of Fallot, which involves severe underdevelopment of part of the right ventricle and constriction of the pulmonary artery, and thought that possibly because those that had a ductus, which we remember is a tube right here, were less symptomatic, that if somebody could build her a ductus or move the pipes around, as she called it, that the patient could be improved. Vivian Thomas spent more than a year in the Hunterian Animal Lab developing this shunt surgery. Blaylock himself had not performed it before the first time he did it in a child. This is not the first operation. It's commonly referred to as the first operation. There's no picture that I'm aware of the first operation, but it's the second or third. And it was also had a movie camera, and a film of that surgery was also done at the time. Here's Vivian Thomas standing behind Blaylock, still guiding his hands, and he did so for several procedures before Blaylock felt comfortable enough to do it on his own. Well, now Taussig is world famous, and she goes on to write a textbook of congenital malformations of the heart, the first one that was this comprehensive and this based on clinical material, and published first edition in 1947. She makes no mention of Maude Abbott in the preference. She profusely thanks Edwards Park. She describes diagnosing absent right ventricles by chest X-ray and EKG. And in a separate part of the book called the plan for the book, she writes, Dr. Maude Abbott in her studies of congenital malformations of the heart divided all malformations into three groups: the cyanotic group, the cyanos-tardive group, and the acyanotic group. This classification has a sound anatomic basis. However, Dr. Abbott's classification is of no aid in the clinical analysis of congenital malformations. Therefore, it is not used in this book. And all due respect to Dr. Taussig, but the cyanotic group, this is a group of patients that became cyanotic without surgery, and the acyanotic group is very much how we refer to the patients today. So there were similarities between the two. Both mothers died early. They had difficulty entering medical school as women. They were both single, focused, and driven. They had important mentors, Osler for Abbott, Park for Taussig. They had career challenges for lack of recognition by male-dominated academic medicine. There were differences. Obviously, Abbott was senior. She was a product of the 19th century. She was outgoing and a pathologist. The junior Taussig grew up in the 20th century, very reserved and a clinician. The story of their association remains elusive. Possibly more written or photographic evidence will document their connections. It remains undiscovered. The available records suggest that these two accomplished, independent women, a generation apart, may have perhaps simultaneously both appreciated and envied one another. The Holmes heart, as you saw, is still alive in the 21st century and still has a beat as we take care of these children with this condition every year. The surgeries now are a series in the newborn, in infancy, and young childhood. And this condition, once having 100% mortality, now has nearly 100% survival. And these two dominating icons and founders of our profession have taken the Holmes heart from a specimen in a jar, to an arena in which is now more advanced than the bridge of the Star Trek Enterprise. Thank you, and happy birthday, Dr. Taussig.